Now it's my honor to introduce my dear colleague, Dr. David Okonkwo, who truly needs no introduction. However, I was remiss not to mention that he is the professor of neurosurgery at UPMC, director of scoliosis and a spine surgeon, also the director of neurotrauma and critical care trials. He also served as a team neurosurgeon for the Pittsburgh Steelers. He's a past chair of AANS CNS section on neurotrauma and critical care, and please join me in welcoming Dr. Okonkwo to the stage.
All right, are we live? Is this on? Can you hear me? All right, we got three fantastic guests that I would like to join. Join me on stage here. Dan Scavilla, if you wouldn't mind joining us, President and CEO of Globus Medical. Pat Miles, President, CEO, Chairman, Alpha Tech Spine. And then Chris Patterson, please join me as well. Chris Patterson, who runs innovation enablement at Medtronic, as well as strategic partnerships. Thank you very much, gentlemen, for joining us today. Please have a seat. All right, we are at an amazing point in the history of spine. We've had a number of changes in the industry, and we're constantly in a state of moving forward. And what I find so fascinating about having the three of you here is that you represent companies that are in different inflection points in your corporate life cycles. So I'd love to hear from each of you how innovation integrates with this moment in your corporate trajectories, as well as how innovation helps you compel and win the marketplace. Dan.
Thanks, and good afternoon, everyone. I think we all need innovation, and from many sources with this. When you think about your best outcomes being in the 70s when it comes to fusions, the need for all of us to look at the proceduralization and the better drive for that, to get this higher up, more into the range of joints, the high 90s, things like that, are out there. And we have a long way to go. And it's not just a widget or an instrument or an enabling tech. It's the sum of everything that's out there, including artificial intelligence and everything that we have to build in. So the need for industry to partner with surgeons and societies, drive that forward for the sake of patients right now, I think is at the forefront of what we're doing with Globus.
Fantastic. Pat.
Yep. I would say that the only relevance is to do something better. And so to not be in this to do something better is a waste of time. And so, I think our thinking is how do you mitigate variables? And, you guys deal with so many variables. You guys rig more things than any group, So it's like, how do we mitigate the variables and create a level of predictability that would go with spine care? And I think that being a standalone spine company and focusing only on spine care, I think is a profound advantage to be able to say, what are the requirements of an industry that still has a long way to go in terms of evolving? And so we think the whole innovation thing or the pushing the envelope is the only way to go.
I love it. Chris.
Yes, I agree with a lot of the things that Dan and Pat have said. The things that we see at Medtronic too are, innovation can be in a lot of different arenas. It can be on the product side, it can be on the procedural side, it can be in the data analytics side. And overall, the things that we're trying to do is really push the envelope on, how we're actually connecting things together throughout the entire procedure, throughout the entire patient journey, how we're actually trying to make things more predictable. So similar to what Pat said, and also Dan, really trying to reduce the variables, that you face and that a patient may face. And then ultimately, how do we make sure that we're getting the better outcomes for those patients? The data sets that are behind those too is making sure that we're not just leaving the data in the EMRs or in the computers, but making sure that those are coming back to the R&D cycle, coming back to other areas of opportunity to make sure that we're advancing care with you through the process.
One of the most enjoyable parts of spine surgery, at least for me, but I'm sure is true of many of my colleagues, is this marriage of technology and care. And our ultimate goal is to do the right thing for the patient and to maximize patient outcomes. But give me a sense of each of your perspectives on these technologies, thinking of AI and robotics, augmented reality, but maybe there's something we haven't really thought of. How is that going to help us transform spine care? You want to start, Pat?
Sure. I think that the currency has been in implants, and so there's been this kind of focal craze toward let's continue to design and develop implants because that's going to further care. When the reality of it is kind of back to the variable mitigation. It's like how do you create informatics that drive more insight? And so one of our pieces of thinking was it's like I think one of the most coveted images in all of orthopedics is a standing full body biplanar view. And so we acquired EOS under the auspices of what information can we provide you prior to the intervention that will ultimately reflect in greater predictability. And if the goals of surgery are become predictive through the whole data elements, we feel like that's a contribution to furthering the field. And so the interest we had was to say, let's start before the intervention and let's think beyond that, and let's start to be purveyors of information that drive improvement.
Chris?
Yeah, I would say that if you look at any of those technologies, whether it's utilizing AI, utilizing robotics, or utilizing other types of technologies, independently they're okay technologies. But the only way that you're going to really make advancements is making sure that we're connecting everything together. If all we're doing is saying, hey, you can throw a pedicle screw through this robotic arm, or you can put in this best fit implant, patient specific, but still best placed implant for this patient, but we're not connecting all the dots from pre-planned or pre-surgery all the way through to the outcome side and then coming back around. I don't think it's going to be advantageous for us as a group of surgeons and a group of industry professionals. And so it's trying to make sure that we are connecting the dots, that we do have connectivity all the way through, to make the advancements.
Please.
No, I'll build on that quickly too. I think one of the reasons that we moved beyond spine into knees and hips is we think that they're all connected in how a patient stands and leans and the stress points that go therein. And so, back to even what these two gentlemen said, looking holistically at the entire picture, using the right technology to do that allows you to create a predictive or an analytical planning session the whole way, I think can really make a difference in the long term.
Each of you have large sales forces that ultimately answer up to you. And your sales reps are perpetually trying to gain an audience with spine surgeons. You have an entire audience of spine surgeons, but you're not sales reps. And I'd love to get a sense from each of you. Share one thing about your trajectory to getting to this point in your career, an inflection point in your own personal journey, and then sitting in this moment with an audience of spine surgeons. What are you hoping to communicate to this group? You want first crack?
Wow, that's a big one. All right, I'll do that. So I'm a finance guy by training, and through my pathway that was doing that. And in my career, it took me a long time to figure this out, but I did learn that my skill set, when applied the right way, can actually change lives. They can make a difference. And I realized that something more powerful than me or doing that was, can I contribute and make a difference that way? And I've taken that with me through life. And I think all of us in this room have the ability to change thousands of lives with what we do and can do. And to me, that's what gets me out of bed each day and goes, that's the most meaningful thing, is that.
Yeah. I was the.
Well, you're new here, Pat. This is your first day in spine.
Yeah,
welcome.
It feels like it every day. I got to be the guy who taped patients to bed for Dr. Pimenta down in Brazil when we were trying to do the lateral thing, and then before that I was the product guy at Sophomore Danik for the tube system that Dr. Foley put together, and so I've been in more 3-hour discectomies than any human. I think the reality is I love spine. I love the clinical dynamics of spine. I love that there's an opportunity to make it better. I'm not going to be a material science guy that's going to argue with you about hips. And it's just not, that's not I think spine still has such a ways to go, and there's such an investment opportunity to make it better. And again, I think that, we've been led astray with the currency of implants that ultimately undermines the kind of the financial thesis of a lot of companies. And I think that if you appreciate, what can be done to further the environment, I think the investment thesis becomes quite clear.
Interesting.
Yeah, so before med device, I was actually in the automotive industry. And so as an engineer in the automotive industry, I was designing car parts. And you really don't need a whole lot of, I'll say, collaboration to design some car parts. You have some specs that get sent down to you by the car makers, and then, you send back your designs and they're good to go. When I came over to the med device side of things and spine in 2004, I started designing, products. Well, you can't design a product very well if you're not talking to the people that are using it at the end of the day. And, that was a big inflection for me, is making sure that you have good strategic partners that you're working with. Every one of you in this room is, have used, a lot of the therapies that, either we provide or the companies that these two gentlemen work for as well. And so it really comes down to, how do we make sure that we're partnering together to push the envelope on where we can take things for patient care. And that, that really started, like I said, 20 years ago when I joined the industry. As I moved out of engineering roles and more into business roles, it's how can we not only influence the product and technology side, but how can we influence the policy side? How can we influence the healthcare system side? And really making sure that we're driving, for, I'll say, community benefit and overall industry benefit.
There's a fascinating part about neurosurgery, which is that turns out spine surgery is a lot more challenging than brain surgery. And that's not readily appreciated by the world at large. There's this myth or actually mysticism also almost about brain surgery, and we're thrilled that we have a growing number of orthopedic surgeons that are connected to Spine Summit and making this meeting more robust. But it's wild that at the end of the day, it's actually more challenging in spine surgery than it is in brain surgery. There's a tumor, I need to fix it. In orthopedics, there's a fracture, I need to fix it. But in spine, we are just confronted with the uncertainty of what to do. As you go to work every day, and as you all try to impact spine, not just your company, but spine, I'd love to hear what excites you most about each of your companies and the place where you are. What excites you most about being in this game?
Anyone?
Anyone.
Go ahead.
Sure. I'm just kidding. I think, it's a fascinating time in spine. It's like years ago, when we were at Sophomore Danek, we had a ton of mechanical engineers. We have 250 engineers. Only half of them are mechanical. The other half are software, data science guys, physicists, and so what excites me is the opportunity to be predictive. And I think that spine has gone this route of how do we get more precise, robotics and navigation. I think how do we get more predictive? And I think that when you house a bunch of people who are ultimately trying to provide information that drive a level of predictability because we're mitigating some of the variables, I think that's exciting. And I think that when you start to say, what's the problem of spine? Forgive me, it's not screw placement, it's not implant placement, as much as it is a lack of understanding as to what the specific patient requires with a specific pathology and what the intervention should be.
I get it.
Yeah, and I'll build on that. I agree very, very much with that. I think the ability to gather data, consistent data for predictive analytics that allow a surgeon to make the decision. And I say that because I don't want a machine to make a decision for me. I want a surgeon with experience to do it, but give enough information there so that they can make, I don't want to say better decisions, but certainly have more rounded facts to do. And it's exciting because we all have in place the ability to gather that data, to collect that data from the enabling tech that we're doing. We have great partnerships. And when we do this, spine 5 years and 10 years from now can be radically different when you're making fact-based choices as a surgeon.
I agree with all of that, and I would also say, as we look at, where we've been, we traditionally had been just, I would say a hardware company and then also enabling technologies company. But how can we become more of a tech company? How can we become more of a data company? Because that's really the currency and what's really driving things. If we're doing the technology and the data side of things well, then the hardware and the enabling technologies will actually catch up to that and will actually allow more precision, will allow more better patient outcomes, reduce variability, and then allow for, I would say more acceptance, as you say, of spine surgery from the payers. I'm sure everybody in this room has had tons of calls that they've had to do with their payers over the last few months. And so, how can we continue to prove that spine surgery is a good, is a good therapy or a good way to treat patients?
Yeah, that's a great segue to this next point of we suffer every day because things get inserted in between us and the patient, whether that is insurance companies, whether that is hospital administration. We by and large just want to be left alone to do the right thing for our patients. At the same time, we live in ecosystems, and we are living in bigger and bigger ecosystems that we have to navigate. Mm-hmm. And so when you hear this word strategic partnerships, it can have many, many manifestations. And I would just love to hear perspectives on ultimately the strategic partnership needs to be with the surgeon. We live in times where there are now things being inserted in between the surgeon and the products or technologies or companies that we want to use and work with. And so that comes at it from a lot of different angles, but I'd love to hear a perspective from you all about how do we navigate these things going forward so that we are most successful in making the best choices for our patients. And so if we start with just hospitals, how do we marginalize the people who have nothing to do with patients, or perhaps integrate the people that have nothing to do with patients because we can't get rid of them? How do we navigate that partnership?
It's a tough question, David. You've got you have a lot of stakeholders within the hospital system. You have a lot of stakeholders amongst yourselves as you're looking at what technologies you're using and how you're going to be treating your patients. I do think it's a partnership that we've had collectively between industry and the spine surgeons, that we could make sure that we're approaching the hospitals in a different way, in a better way. I also think that the hospital systems have changed their thinking about how they're looking at us. And, I think we've, I would say we still have some work to do in how we're approaching, the hospital system to show overall value. They're looking at value-based care. They're pushing report cards down to a lot of surgeons and what have you. And so I think we've got to be a partner to you guys to be able to say, hey, look, this is actually how they're performing on the data side. This is how they're actually performing on the patient care side. To help you push that back up to the hospital system as well.
I'll build on that too, because I think you're right on the money, Chris, with that. And when you look at some administration, we have to educate people that the cost of a surgery is not the implant. It is holistic throughout, on the time in the OR, what you're doing, is it revision, the rates of infection, on and on. And I think there's a way to look holistically at that perhaps we have to do better as surgeons in industry into administrators who aren't going to go away. And while scorecards need to exist, are they measuring the right things? And my thought is probably not right now.
I think both these guys make the right points. I think there's so many ways that our industry is archaic, and I think from a supply chain perspective, from a case planning perspective, from a fulfillment perspective, there's light years of things that we could do to ultimately improve what's going on in SPD or what's going on, within the hospital. And so, I think there's ways we can be better partners, and I think that we will continue to do so or be left behind.
Yeah, and we're going to have to figure out better ways to structure those things. You're also faced week in and week out with decisions that relate to inorganic growth. And so when we think about that concept of strategic partnerships, I'd also love to hear from you your thought process on how you navigate which technologies you want to bring into your spheres that ultimately will connect to us doing better for our patients.
Go ahead.
Thanks. I would start with just our approach, as you know, is a lot of financial discipline. And the reason for that, beyond being frugal, is it gives us the ability to invest in multiple things. If you ask me what is the one thing, my real answer is I don't know. Right? It can go in a lot of different directions. But if I can put resource and outcome on several different things and follow that through as markets evolve and as we have hits, it allows me to pivot better. And so I think the real thing for me is the ability to have multiple investments in really what is an unknown thing. I think we all agree data and better capture is there and stronger enabling tech is there, but it's all of them. It's not just one. And so I think you need to be present in all of those things.
Before you guys get to it, I'm going to say that I'm going to give Juan Uribe a chance to ask a question if he wants, but we got a few more things to get through, but keep going. Thank you for that.
Yeah, I would say automation. For years I've lived through proms, lived through data sets that were, incomplete, and everybody whining about data. If we can ultimately automate some of the data collection efforts in a way that ultimately drives true information that furthers decision making, that seems like an approach that would bear fruit. And so from a pure, as I think is something that stands out to me, automating data collection.
Chris.
Yeah, I would say on the way we look at innovation or strategic partnerships from an acquisition point of view or even partnership point of view, it comes down to what are the things where we want to place some bets. We can't, all three of us are in publicly traded companies that have, financial metrics that we're trying to hit. And, when you do acquisitions, you get to look at things a little bit different. You get to leverage balance sheets as opposed to having to do your direct expense. And so to Dan's point, you can do multiple things with that. That's one of the, with the way we've looked at things, we try to do a number of what we call tuck-in acquisitions. So they're complementary to what we're already doing, and things like Titan or things like what we've done on the enabling tech side of things. Those are great opportunities for us to continue to build things out without having to do it internally. The other things that we try to do is if we're we try not to get outside what we call our core competencies. As Pat said, some of the data analytics, folks, that by and large may not be a core competency of a lot of companies. And so you can go out and get that competency by doing a partnership. Similar with like what we did with Siemens recently, we've done a partnership with them on the imaging side. They are a leader in imaging, and so that's been a good opportunity for us to partner without having to take on the burden of financial impact internally.
Recent UCLA MBA grad Adam Cantor, former chair of the spine section, and WWE fanatic, has a question.
Great, thanks, David. How do we reconcile in today's environment where we're looking for more precision care, more custom care, custom rods, we want everything to be custom, the patients want it, in an environment where we're actually trying to get cost containment? If you look at other industries, in the car industry, in home building, is that they go in the other direction, right? We're trying to get cost containment and we're decreasing customization in that industry. How does it that we somehow provide that higher level custom care in an environment where we're being told by everyone, including the industry, the hospitals, the payers. It's got to be cheaper.
So first off, it's a great question, right? And one of the things is a decision from the surgeon. Does it need to be custom or not? Right? That's something that has to stay in your hands to do that. But let's say the answer is yes, it needs to be custom. Then it really is about utilizing, honestly, manufacturing technologies and data to do that in a faster way. So most things will be 3D printed. How do you do it faster, cheaper, get it in there? And there really are ways to move down a custom path that are not cost prohibitive to do this. But it does require good data, good information. You need to make the right call because it is custom, so it better darn fit when it gets in there. But truth is, pursuing that is not something that I look at and say that will take us off our cost targets. I think it can actually help because I also probably need less things in the room to do it. And so if you look again at the entire procedure, not just the cost of the one thing, I think you can make good decisions where that is one of the future paths. And I think it's very obtainable even in that environment.
Yeah,
Yeah, go ahead.
No, I wasn't going to patronize Adam with that. Was a
No, please do.
I'm totally kidding. I completely concur with your points. It's like I don't think it has to be more expensive. I think that candidly, we spend an absurd amount of money with all of the trays and everything else. 75 cents of every dollar, from our standpoint, goes into capital the first year of that dollar growth, and it's absurd. And so our ability to understand what you need in a much more refined way minimizes SPD. I think the whole implant refinement, the customization, having just small sets sterile that go in is going to be a better place. And so I think the opportunity is to take cost out.
So we're getting to the end here, and again, we have an audience of spine surgeons, and I'd just like to hear from each of you. What do you want your legacy in this industry to be?
Yeah, I mean, I would say that, when I started 20 years ago at Medtronic, I think, the overall, perspective was that Medtronic Technologies, is able to treat six patients every second or something like that. And I think we've gotten down to, it was one patient every 6 seconds, and we've gotten down to 2 patients every second. And so I think long term, it's how can we make sure that we're addressing, more and more patients. We're doing things predictably. We're doing things, through, I'll call it precision surgery and also reproducible surgery that really changes how, I'll call it, and even to Adam's question, changes the economics in healthcare long term. I think if we're able to advance technology, give predictability, and address the economics, that's going to be a huge opportunity for us.
Yeah, Medtronic has been in this amazing place for a long time, and so when I hear from the two of you to finish off this session, I'll just preface it by saying, Alphatec's in a very unique situation on this rapid upward trajectory, and you're filling a different niche from the other two fantastic folks who are on stage with you. And then Dan, Globus has made major moves in the last few years that are disrupting the industry on many levels. And so, with that backdrop, what do you want your legacy to be, Pat, and what do you want your legacy to be, Dan?
Yeah, I don't care so much about my own legacy. I want to make sure that I've had the ability to work with some unbelievable people to revolutionize the approach of spine surgery. And we've done that once, and I'd love to keep doing it and build a standalone juggernaut that has an internal culture that perpetuates that. It's that would be great.
I just want to be remembered by Pat Miles.
Oh, jeez.
we got a role for you.
Final thoughts.
That's it. I'll stop there.
No, look, at the end of the day, it's such an incredible privilege to be in spine. And what we do is we change lives, we improve lives. It's a genuine privilege to do this, and we have to do this together. And so I know that we're grateful for you and your colleagues in the world of spine that continue to iterate and continue to disrupt and continue to bring the technologies we need to help us all get better. So thank you all very much. Thank you.
Thanks.